We've already looked at an interactionist approach to explaining the disorder, and we looked particularly at one model, which is the diathesis stress model. But now we're looking at how this can translate to effective treatment for the disorder. So an interactionist approach to treating schizophrenia involves combining different therapies. So it involves combining biological, like antipsychotics, and psychological therapies like CBT or family therapy. It's very common to use an interactionist approach, particularly in the UK. In the US, there seems to be a bit of a conflict between biological therapies and psychological therapies. So over in the US, they tend to favour one or the other, whereas in the UK, it's very, very common for schizophrenic patients to be receiving both antipsychotics and some form of psychotherapy. So in terms of the biological therapies, here we're talking about antipsychotics, and we've looked at these in detail in the biological treatment section. So these therapies help reduce the severity of symptoms, and we know that this is really important because without the severity of symptoms being reduced, it means that people are unlikely to be able to fully engage successfully with cognitive therapies. So for example, if they're suffering from really severe delusions, then they're not going to be engaged in CBT. They're not going to be able to question and challenge their thoughts and really step outside their thoughts and think about them objectively, which is necessary for CBT to be effective. So biological therapies are often prescribed in the first instance to reduce the symptoms so that then psychological therapies can have greater effect. So the first step is usually biological therapies, and that is then used in conjunction with cognitive therapies like CBT. And the purpose of these is to address the disordered thinking. And it's helpful to allow somebody to function better with their symptoms. It's not necessarily going to reduce their symptoms, but they're able to better understand them and they're able to better function with the symptoms there. And then this then will allow the behavioural therapies to be effective. So this could be focusing on maladaptive behaviours within CBT and trying to replace maladaptive behaviours with more functional ones, or this could be other behavioural therapies like art therapy, for example, or other behavioural management techniques like token economies. So the first step is really in reducing symptoms using biological therapies like antipsychotics, which then allows somebody to engage fully in cognitive therapies to address their disordered thinking, and then we can start focusing on behavioural changes. So teaching people functional social skills, which will allow them to behave and function better beyond hospitalisation. So without the cognitive restructuring, which we see in CBT, the patients are typically too disordered for any of those behavioural therapies to be effective. And so the cognitive therapies are necessary for behavioural therapies to be effective, and biological therapies are necessary for cognitive therapies to be effective. And so they all really work hand in hand. However, the particular combination of treatments and which one is best is really down to the individual. So for example, family therapy is only going to be suitable if there's family dysfunction. So it's mostly going to be helping families where there is high expressed emotion, for example. Although it can be helpful for everybody, it's going to be most successful when it's being used with individuals for whom they're experiencing family dysfunction. And so obviously the particular combination of treatments is going to be determined on a case-by-case basis. For your AO1, obviously all of this is relevant, but also just sort of a brief outline of these treatments, very brief, is relevant. Okay, so let's move on to look at evaluation. And with any type of therapy, I think it's really useful to think of evaluating in terms of both its effectiveness and its appropriateness. And so we're going to be looking at research support for the effectiveness of interactionist treatment by Gao. So in Gao's research, this was a randomized controlled trial. And as we know, this is the gold standard for any research into psychological disorder and therapies for psychological disorder. So in this study, they're looking at a clinical sample of over 1,200 patients that had early stage schizophrenia. So typically looking at patients who have had their first psychotic episode. And patients were randomly assigned to either the antipsychotic medication only group or antipsychotics plus psychotherapy. So these psychotherapies consisted of psychoeducation, family intervention, skills training, and CBT. So here we're talking about just bio alone, and here we're talking about bio plus psychotherapies. And the findings, unsurprisingly, is that patients that were receiving both biological and psychological therapies had lower rate of treatment discontinuation, meaning they adhered to their medication more successfully. They had a lower risk of relapse. They had better insight into their disorder, which is obviously very important for CBT to be effective. They had higher quality of life and increased social functioning. So basically on every measure of effectiveness of treatment, the individuals who are receiving both biological and psychological therapies were seeing increases in effectiveness. So this tells us obviously that an interactionist approach to treating schizophrenia is more beneficial than just a biological treatment alone. So not only is it effective, it's also effective in reducing relapse. And so relapse is obviously when somebody's symptoms re-emerge or when they're hospitalized again following a successful period of reduced symptoms. So here we're looking at relapse in the first year in 103 schizophrenia sufferers in different conditions. So in those that were receiving just drug treatment, the risk of relapse in the first year is 41%. For those that are receiving antipsychotic treatments and social support therapy, so this could be sort of group therapy, this could be skill acquisition, etc. The risk of relapse was 20% when receiving some sort of psychotherapy and biotherapy. When receiving family therapy and drugs, another combination of psychotherapy and biological therapies, the risk of relapse was 19%. And when a combination of all three types, social therapy, family therapy, and drugs, the risk of relapse in the first year is 0%. So this tells us that a combination of social, psychological, and biological treatments is most effective in preventing relapse in the first year of schizophrenia, in schizophrenic sufferers. However, just one thing to be mindful of here, this is only in the first year. There are suggestions that follow-up studies suggest that combined treatments only delay relapse rather than prevent it. Obviously, we would need to conduct further follow-up studies and perhaps longitudinal research to determine how effective interactionist approaches are to treating schizophrenia long-term. Of course, although they're effective, we have to consider the cost that's going to be associated with an interactionist treatment. Drugs, we know, are cost-effective in the short term, but obviously they're likely to be prescribed for life, so long-term, actually, it can create more of a burden for the NHS. We know that CBT is quite expensive because it requires many sessions over a long period of time with a trained specialist, and we know that often the waiting time for CBT therapy is quite long. I think at the moment for depression it's about 9 months. And of course, if we're combining psychological therapies like CBT with drugs and biological therapies, plus social therapies as well, like social support, then that's obviously going to increase the cost. So combining therapies is going to be much more expensive, and we need to think about, therefore, the implications for the economy. However, if it's preventing relapse, if it's preventing hospitalization, then it might mean that actually, in the long term, this is a better way for treating schizophrenia, rather than just relying on drugs, which people often discontinue after 6 months or a year, and might be more effective than just psychological therapies alone. So although, yes, it is more expensive, again, in the long run, it actually might be a more cost-effective option.